the project is obviously a really important part of the fellowship application. And the difference versus a project grant is that in a fellowship application, there is a consideration to the training and development of the individual. With this in mind, to some extent, the research project is used as a vehicle to develop you as a career researcher within academia or in clinical practice. So you've had presentations on the person, education, that covered the training and development part of the fellowship application and environment. So my presentation will cover the project. As with any research project, you need to start with a good question. So what makes a question fundable? You can follow everything else you hear today, but get it wrong here and none of it will matter. Largely, your project will need to relate to clinical and applied health research, including social care research, with a clear potential for directly benefiting patients or the public. Have a look at these web links for details of the remit for personal awards. So these web links and others in my presentation can be found in your handbook immediately after my slides. So know who you're dealing with. Panels have a variety of experience and backgrounds, clinical and methodological. These may be people from your health area. However, they may only be loosely familiar with the area. So don't assume they will understand why your question is important. You need to convince them that your question is important. So how do you do that? Make sure your questions address a clinically relevant and important topic. Make sure they're timely. I'm sure everyone here thinks their question would benefit patients or carers or healthcare professionals or the NHS more widely or the public. So how do you make your question stand out? So everyone is invested in their own ideas to some extent, but there are ways of showing that the wider health community are asking for your question to be answered. The NIHR has various themes of interest, so mention this if your work aligns with a theme. NICE gives recommendations for research, often supported by systematic reviews. James Lind Alliance brings together clinicians and the wider public to set research priorities. They tend to be quite broad, so perhaps your work falls under these priorities. There are recommendations to be found in the wider literature, professional bodies, voluntary organisations, charities and patient groups. Timeliness is another way of showing the importance of your research question. Is there a good reason that your research needs to be done now? For example, the current NIHR themed call is around prevention. There are previous NIHR theme calls that remain ongoing health priorities for the NIHR. It's too many to mention, but see the theme calls web link. On the same web page, highlight notices call attention to areas of ongoing health research priorities for the NIHR, which are currently work and health, compound pressures, brain tumours, motor neuron disease and dementia. In addition, the NIHR Academy are particularly interested in receiving applications that develop skills and experience within the NIHR Academy strategic themes. At the most recent Cohort 1 call, these were social care, mental health, public health, health data science, researchers working in a local authority setting, and applicants hosted by post-92 HEIs and non-university hospital practice settings. So applications received under these strategic themes will still have to meet the same quality threshold required for funding, but they'll be given priority if the number of fundable applications exceeds the maximum that can be funded. Piece together all this information to form the bigger picture. Refine your question in light of the literature. Know what has been done and what is ongoing. So search the NIHR Funding and Awards link, trials databases, and the NIHR Journals Library, although this library is now closed to new submissions. Try to understand and explain the context of where your research sits now, its current and future importance. Then you've got to sell this information to the panel so you can answer these questions. As mentioned, don't assume the panel know your research area well. You've got strong justification for the question, but you need to convince them still that it is worth answering in terms of potential benefits to people and the NHS. Back to the literature. With a clear question, it will be easier to look for what you need. Think of funneling information. Start broad, but not too broad. Don't just tell the reader, for example, how many people die from stroke each year if your project is about stroke rehab and people who survive. Think about impact to patients, to carers, the public, to the health and or care services, as evidenced by things like the scale of the problem, costs, sheer volume of people, or impact on individuals. Focus on those bits that will potentially have an impact, you will have an impact on. Remembering that impact is you demonstrating the contribution that research makes to society and the economy of benefit to individuals, organisations and nations. In the background and rationale, consider whether your own additional subheadings or highlighting key words will help you tell the story. Maybe something like this or similar. What is the clinical problem? What is the existing solution to this clinical problem? Say the existing solution has problems. A new solution gives the opportunity for improvements. My research will provide a better solution. And the aim of this project is therefore to investigate whatever it is. Provide a clear explanation of the health problem to be addressed, the impact on patients as well as health and care services, and how this research will fill an evidence gap. We need to clearly identify the health and care need your research meets or contributes to. Outline the anticipated value or contribution your study will provide. Explain why this research is needed now, both in terms of time and relevance. The NIHR will only fund primary research where the proposed research is informed by a review of the existing evidence. Doctoral applicants and early career postdoctoral award applicants can propose to undertake a systematic review as part of the fellowship, providing it is well justified. In summary, you need to have achieved this so far. Developed a question that can be supported by the literature, convey the importance of the question to non-experts. So now you have a question, you need to explain how to answer it. You need a research plan. Every piece of research is a battle between the ideal and the feasible. For example, what might be statistically desirable versus what is doable. You will need to justify throughout, but remember, this is not an essay. Waffly explanations will not be received well. The usual starting place is a broad design. Certain questions may lend themselves better to quantitative or qualitative research. This choice should be dictated by the question and not your own preferences. This can be worked on in your training if you feel you lack expertise, but make sure you're not coming into it completely naive. So once this is determined, the standard theoretical considerations would then relate to who your population of interest is and how you sample them. Sample size must be presented and justified. You need to demonstrate how these factors have been considered and addressed in your proposal, including steps taken to ensure the research sample is representative of the population the study is targeted at. Include how your participant selection considers the needs of diverse communities, typically underserved by research, geography, and health and care inequalities. Applicants need to explain who they are planning to recruit to ensure inclusivity of study participants, and justify and explain any exclusions. So from clockwise at the top left, have you thought about where you can recruit from and how this will take place? Start from identifying potential participants through to them consenting to take part. Recruitment is often a major concern for any study, so provide evidence that your target sample size is achievable. Is the process of data collection clear? Who will collect the data and when, and using what methods? Are the methods you have chosen most suited to answering the question? Is there a clear plan in place for data analysis? Does this clearly relate back to the aims and objectives of the study? Remember, methodological experts will be reviewing this. And lastly, is the plan well thought through in terms of timings? Along with using the NIHR guidance notes to help you complete the application form, you can use reporting guidelines found on Equator to help structure your research plan, and Good Reports tool to help you find the right reporting guideline. Is what you plan to do feasible? Are you trying to do too much? Is it too complicated? Are there too many ideas? Have potential problems been identified and accounted for where possible? And do you have a contingency plan? So you need to have designed a study suited to answering the question, presented and justified the design choices in a succinct manner. What do you intend to produce from your research? Think beyond journal articles and conference presentations. How will you target the right groups of patients, clinicians, the wider population, NHS commissioning groups? In describing the anticipated impact, consider patient benefit, changes in NHS service or care services, and any commercial return. Is there a clear route to integrating your research into practice in the future where appropriate? Think about implementation. The NIHR has some useful information on what it means by knowledge mobilization, dissemination, and impact on the first web link. Also, you can watch a recording of a lecture I gave at our Essential Guide to Grant Applications course in April 2025, which is on our RSS YouTube channel, as it contains many more useful links. So outline the processes that will be put in place to ensure the research described will be well managed. It's always a toss-up between cost and potential benefit. Where is the value for money? Are you competitive? It's worth knowing what amounts of money have been funded previously. You can look on the NIHR website to see these figures on current and completed award holders, as well as information on the funding and value of NIHR awards in general. Often the plain English summary and scientific abstract are the first thing a reviewer will read. So this is your front cover, and people will start to form a judgment of the book by its cover. So follow suggested guidelines on structure and content. Get support from mentors, the RSS, and patient and public involvement. This is your project. Talk about I, not the researcher. Ensure the panel can see the benefit of the project to you. So in summary, to submit a fundable application, you will need to have also justified the costs and demonstrate value for money. Summarized all of the above objectives in a well-structured abstract. So finally, these are the assessment criteria the NIHR will use to make a judgment about your project. These are taken from the postdoctoral award guidance notes for the project. There are similar assessment criteria for the applicant and training and development and site and support. So check the specific guidance notes for the fellowship that you are undertaking.